back office is really the engine room of surgeries.
We are sort of the forgotten department in a way.
We concentrate on patients, we concentrate on doctors and nurses' appointments. We don't always concentrate on how the rest of the work gets done.
We did get quite a few members of staff who said it's the way we've always done things, but because we've had meetings and talked, I think it has made us look at things differently.
The activity capture sheet that we used was done on a daily basis by each of us, and we needed to write down everything that we did. And within that time we were trying to put if we'd been interrupted and why we'd been interrupted. It really helped to focus on who does what in the office, but also it helped for the practice manager and the doctors to see how long it can take us to do some of the tasks.
What we then did was completed a back office skills matrix, listing all the jobs, then who was an expert in it, who was trained in it but possibly not an expert, and then who needed training in it.
This is the matrix we arrived at. Obviously, names down here, jobs along the top.
Green box is the jobs that everybody can do.
That's right, yeah.
And obviously the benefit of this is we can see where we've got a shortfall in experience, particularly highlighting medical reports solicited. One of the things we found was that the jobs were more designed around the person than the job. So if that person was off on holiday or unexpectedly off ill, it wasn't being picked up. So that was an important thing that we needed to address.
It actually sets out all the jobs that are done. You end up with spreadsheets that show you who can do what, where your gaps are, which can then help you identify your training needs for the future.
We were getting many requests for medical reports, and the GPs often held on to these for quite a long time. The result of that was that the back office and even reception were getting chasers from the insurance companies asking where the medical reports were.
When they actually looked into that, they realised that there was an allocation problem and that I was actually being allocated the bulk of the paperwork for the practice. So when they then streamlined that into appropriate allocations per doctor, I suddenly found that I could concentrate better on my work, I could go home on time.
As a result of productive general practice, we were able to turn around the reports a lot quicker, and the result of that was that we were getting less queries from the insurance companies and from our patients as well.
5S stands for sort, set, standardise, shine and sustain. With that, we spent the best part of a full day going through and sorting through everything. We also had a filing cabinet that was in a different room, which I thought was very important that we could put it into the admin office.
Now they've redone the filing entirely, so if I ask for an abstract and hardly used referral form or piece of paper, I know that somebody's going to be able to bring that piece of paper to me whilst I'm still with the patient and I can deal with it first time, rather than getting the patient to go away and have it dealt with afterwards.
We would have a very hit and miss way of doing the stationery ordering. We went through everything in the stationery cupboard and we went through the whole 12 months of previous invoices and orders, catalogued what we had, what we'd used, and going forward we've now got labels in the stationery cupboard as to where everything is. Being able to focus on how much things were and which supplier we were using has enabled us to talk to other suppliers, talk to other practices.
The whole process enabled us to save around 14% of our costs.
One of the areas we looked at was scanning, being done twice a day, morning and afternoon, and we asked was there any reason why the scanning needed to be done twice a day, and the answer was no. So we have moved that now to once a day, and that has been beneficial, particularly in freeing up time for people doing their own administration work.
With online registrations, we would write to patients and ask them to complete a patient questionnaire which detailed all their previous conditions. What we were finding is that patients were not filling in these questionnaires and we were having to chase them 2 or 3 times. With the new process, we added a patient reminder. So when the patient came in for the first time, it flashed up to the receptionist that this patient hadn't completed the new patient questionnaire. As a result, the receptionist handed out the form for the patient to complete before they were seen by the clinician. That meant that we were not writing to the patients asking for this information repeatedly.
I think that the back office module was really vital as far as the programme went, because there's so many different tasks that are done.
In the past, we've probably made the mistake of saying to the girls, this is how you should do things, this is when we want you to do it, without actually understanding the amount of workload that they've got.
It's clear there's a lot more engagement from the staff. They come forward with a lot more ideas to make the processes easier.
So it really, really helped us to focus on the area and make everything much smoother.